Myrna Moda and Heather Miller will be giving the updates for the environmental health program. Like I did say, Myrna Moda is our office chief, and Heather Miller is our food safety director.
Thank you, Travis. I'm going to share my screen. All right, can you see that?
All good.
Perfect. And let me know if you hear any feedback or anything. All right, well, welcome everybody to the 2024 Arizona Sanitarians Conference. Thanks for joining us. And we're going to get started. And hopefully everybody has been joining. I know I saw people in the waiting room. But in the interest of time, we're going to go ahead and start. So this is our bureau. And our bureau chief is Jennifer Bosford. Our bureau is now the Bureau of Resiliency and the Environment. And under Jennifer is Nikki, Lajavari Cash, Taylor, and myself. And this is our entire team. And we'll be talking a little bit more about all the programs and what everybody is involved in. This is just our Office of Food Safety and Environmental Services. Jennifer reports to our Chief Officer, Eugene LeVar. And here's who oversees some of our team members and what programs we have. All right, so this is our mission and vision, and this is for our bureau. We protect the health of individuals and communities in Arizona by delivering innovative services and driving evidence-based change. And our vision is health and wellness for all Arizonans in the natural and built environment where we live, work, play. All right, so I'm going to talk a little bit about the programs under Nikki, which is climate, public health, and here are some of the things that they've been working on. So the Heat Summit, we convened on October 23rd to discuss extreme heat response plan and collect feedback, partners, and stakeholders, and to outline the goals for the next summit. There are agencies from all over the state that participated.
So sorry to interrupt, but the audio is a little choppy. Is it maybe possible to turn off your video? Maybe that may help.
Yeah, I can do that. See if that helps. I feel like it's I hear myself twice. It's like there's a delay.
Yeah, it is still a little choppy.
Let's see. I don't know if you could just leave back. Maybe? That is that better?
I think that might be better.
Okay. All right. Where was I? Heat Summit. So I was mentioning that agencies from all over the state participated, and the governor spoke about. The governor was in attendance, and she spoke about the importance of heat, and especially due to the increasing in health related illnesses and heat related deaths. So we had breakout sessions and great discussion about what things have been done, what we want to keep, what we want to keep doing as a bureau, as an agency, what we want to get rid of, what's not helpful, and things like that. Another thing, there's been cooling center map updates, and the map has been expanded to show sites in 6 counties now in Mojave, La Paz, Pinal, Pima, Yuma, and Maricopa. So now our well water program, they're working on updating their website, collecting private well water samples from well owners, and also update a few resources, including their arsenic flyer and well owner checklist. If you guys are aware, well water is private wells are not. There's no regulations for them, and so the well owners have to do their due diligence to make sure they test them every year and things like that. All right, and then the climate and health program has a lot of brochures. That was one of the things they wanted me to mention. They're available to assist in emergency response efforts and freely available to all of you guys and to all our partners. And they cover topics like what to do after a wildfire or flood. And if interested, you can email us at extremeweather@acdhs.gov, and we will send you these resources. All right, one of our programs within the Office of Food Safety and Environmental Services is our FDA tobacco compliance program. And they test the compliance at tobacco retailers and conduct advertising and labeling inspections and what they call undercover buys to ensure compliance with the Food, Drug, and Cosmetic Act. These are some of their numbers, and I'll explain a little bit more of what they do. But they've conducted almost 3,000 inspections in 16 months. The way their grant is set up is, the last bit of it was 60 months instead of 1 year. And their new contract was awarded. We had to apply again, and we're really happy that we got another contract with the FDA. And basically, what the program does is that they go to different retailers that sell tobacco. They're accompanied by an undercover youth volunteer, and those inspections were 2,391. So what they do is that they try to purchase tobacco. The kids don't lie and about their age if they're asked, but basically they try to purchase tobacco. They're underage, and they try to purchase different types of even vaping devices. So the advertising and labeling inspections were 584 inspections, and those have to do with how the tobacco industry advertises, and there are things that they can and cannot do. And so again, just statewide, they had almost 3,000 inspections in 16 months. And I think now I'm going to let Heather speak about all of food safety and environmental services updates. We've been hard at work, and you're in good hands.
All right, thanks, Berta. So for food safety and environmental services, we're just going to go over real quick some of the highlights. We've got some more presentations following immediately after us. So for rules, most of you know we're currently in the rulemaking phase for cottage food as well as manufactured food. Travis Ross will be talking a little bit in more detail about cottage food coming up. And the new program is currently accepting registrations. The cottage food draft rules have been posted twice for review and comment. And we held an informal stakeholder meeting on October 24th and received some really good feedback. We'll also have a short update on Man Food this morning by our Man Food coordinator, Frank Gonzalez. Next slide. For the manufactured food court or program, we call it MIFREBS. So that's the Manufactured Food Regulatory Program Standards. So our current grant runs September 23 through June of 26 and focuses mostly on the standards work. And the man food standards are very similar to the retail program standards for those counties that are enrolled on the retail side. We do have a manufactured food, human food contract with the FDA. So we perform yearly contract inspections on behalf of the FDA. And last federal fiscal year, the food safety team completed 48 inspections and 10 site visits. And this federal fiscal year, which started in October, we increased our inspection numbers up to 60. For the manufactured food rules specifically, we've had 2 meetings and reviewed comments, and we'll continue to move forward with that next year. And for the retail program, that's a tongue twister there, but we call it VNFRIPS. First R is silent, but that's the Voluntary National Retail Food Regulatory Program Standards. And we're currently enrolled in that. We end December of 2024, so our grant was running February of 2022 through December of 2024. The state is currently in conformance with standards 1, 7, and 9. We're in the process for applying for the next 3-year grant, and we plan to focus on the next group of standards for us will be 2, 4, and 5, and then we'll have 3 more left for the next grant period. For the risk factor studies, we performed a risk factor study on the state inspected, so the in-state, state inspected prisons and behavioral health facilities, with the aim of that study to identify the most often occurring foodborne illness risk factors. So our primary goal with doing those 2 studies is to take the findings, develop intervention strategies to help improve food safety and reduce occurrence of foodborne illness. So interestingly, both of those facility types, the state prisons and the behavioral health, both showed contaminated equipment due to improper cleaning and sanitizing. So in the prison specifically, the inspectors commonly found that the mechanical dishwashing machine had a sanitizer concentration of 0 parts per million for the chlorine. On the behavioral health side, the inspectors discovered the automatic sanitizer dispenser, most often at the 3-compartment sink, was frequently empty, and there was no verification check for the chlorine sanitizer concentration in the dishwashers. So both intervention strategies for each type of those facilities included training on proper warewashing, implementing a policy on how to warewash, a training program for the facility staff, and then ADHS presented the findings to each facility group, and we created infographics on warewashing and sanitizing. One of the unique things we did, we created a plastic stencil specifically for the prisons that shows the chlorine and the quat concentrations, so the prisons could spray paint that either on a wall or directly onto the 3-compartment sink and not have to worry about the paper signage being torn down or damaged. And then we also made that stencil available to the behavioral health facilities as well. For our standardization program, we're currently in the works to have one of our sanitarians standardized by FDA to help standardize other sanitarians throughout the state. And we're planning on that happening early next year in January. And then the program will be further developed throughout years 25 and 26. We also hope to offer the pre-standardization courses again, like we did earlier this year. I know many of you participated in those. Those were held in Maricopa and Pima County. The FDA is actually looking into a virtual option for 2025, but we'll have more information to come on that next year. As far as our retail inspections, for those of you that work in the food, at ADHS, we inspect state prisons and then the behavioral health facilities, produce warehouses, and the public school grounds that are not covered under county delegation agreements, as well as inspecting the licensed marijuana kitchens. And ultimately, the statewide environmental health program relies on all of your great work from the county partners to perform thousands of inspections throughout the state. Next slide. We'll go real quick over outbreak response. So on the outbreak side, the Foodborne Task Force, that's a quarterly meeting. It's a collaborative effort between ADHS EPI teams, food safety, and the state agriculture department team now. These meetings are extended to all the local counties as well as other stakeholders with the purpose just to address emerging issues in food safety. The collaboration is obviously a joint effort with the county and ADHS when addressing multi-county outbreaks, with a super high importance on information sharing and coordination. For the FDA collaboration, especially on multi-state outbreaks, ADHS and FDA share information, such as invoices needed for traceback through Food Shield, which many of you have been involved in obtaining those invoices. So ADHS will request from the local counties information to be shared with FDA. And we also participate in the outbreak response core calls, which some of you may also sit in on. And that's the coordinated outbreak response and evaluation meetings. For our process mapping, our group with environmental health and the food safety team, we work closely with our EPI team. We've begun mapping out the process for FBI investigations, so for foodborne illness investigations, using a flowchart design. So we actually have gone back and used past investigations to guide the design layout, and we'll also be including the State Department of Ag on future process mapping meetings. We found it a good thing that having a template to actually follow for an investigation just allows for better and easier coordination between the teams and other state departments. Lastly, the rapid response team is now currently led by the Arizona Department of Agriculture. They applied and received a new grant. So ADHS and other departments will be working with Ag closely in the future on outbreaks. And there's going to be a panel discussion tomorrow specifically talking about the RRT, or the Rapid Response Team. Next slide. We wanted to give a big thanks to the whole environmental health workforce. We really hope you enjoy the conference today. We truly appreciate all the hard work that everyone puts in across the state and everything you do for the people of Arizona. We wouldn't be able to accomplish everything we do at the state level without all the help of everybody working together in environmental health. So we're actually behind a little bit of time, so we'll zoom through the last thing here, but we just want to thank you again. Hope you get a lot of great information over these next 2 days. And I think the next slide, we just want to share our group email addresses. If everyone's not aware, we do have eight. So we have now 8 program email addresses. These are on our webpage, but they're not all grouped together. So we've got one for general environmental health, food safety, cottage food, sand council, man food, school garden, marijuana kitchens, and smoke-free Arizona. So I think that brings us to the end of our opening presentation here.
Yeah, that's it. I'm going to stop presenting now.